Good evening, everyone. My name is Beverly Rodriguez, and my oral presentation is on HIV among Black men having sex with men. The HIV virus is an acute illness that has devastating effects on the many people's lives, communities, and culture as a whole. Since the first case of HIV was identified nearly 4 decades ago, the gay population, or men have sex with other men, has borne the brunt of the disease strain in the United States. MSM has a high chance of contracting HIV, which has become a significant public health problem. In 2018, American Black homosexuals reported 26% of new HIV diagnoses, which both gays and bisexual men reported 37% of new HIV diagnosed. CDC reported in the same study that an average of 2,000 gays afflicted with HIV die each year. To be a sexual minority in a heteronormative culture is correlated with a number of psychiatric illnesses. Whereas the community accounts for 2% of the American population, it contributes to a substantial 61% of event HIV diseases. On the other hand, it is clear that MSM of color have higher infection rates, which recent trends indicating that the rate is increasing. The disease affects CD4 plus cells, making individuals vulnerable to many other severe infections such as respiratory and cardiovascular diseases, as well as having a severe influence, as well as having a severe impact on their physical and mental health. Identifying the societal and cultural factors that influence their expectations of revealing sexual identities, as well as how disclosure leads to risky sexual behavior, is crucial to further understanding HIV. The intersectionality lens can be used to explore the social context of African American gay men. The injustice that the party faces is complicated by the consequences of racism and homophobia. Instead, the confluence of various cultural forces forms a unique and heightened inequality that requires strong monitoring. There's a lot of heterogeneity and fluidity in the MSM community when it comes to masculinity, gender identity, and sexuality. The double minority status of Black MSM is linked to heightened racism, bigotry, family dissociation, and marginalization. According to the syndemic model, the coexisting issue provide a social environment under which HIV danger behaviors thrive. For example, among the MSM, the social concept of masculinity and psychiatric disorders have consequences for HIV behaviors. Homophobia and racism, when coupled, have destructive, highly destabilizing, detrimental effects on the lives and well-being of gay African American men, eventually leading to disparities in HIV infection rates in this population. Men who have more positive opinions regarding homosexuality as a result of family support are more likely to use condoms to protect their well-being. Furthermore, men from nurturing families are less likely to suffer from anxiety and drug abuse problems, all of which are linked to high incidence of risk-taking habits. When cultural backgrounds are considered together, a clear description of the association between homosexuality and dangerous sexual behaviors emerges. The culture space influences personality formation and sexual behavior emerges. The cultural space influences personality formation and disclosure, implying that the relationships of sexual risk behaviors vary significantly based on disclosure, implying that the relationship of sexual risk behaviors vary significantly based on a particular identity. Behavioral conditions are not the primary causes of high HIV infection. Race in Black MSM and higher level factors are more likely to play a key role. Racism and homophobia, when combined, have detrimental and potentially destabilizing harmful effects on the lives and health of homosexual African American men, resulting in disparities in HIV infection rates within this population. Cultural disparities in lived experiences and prospects are linked to inequity in the United States owing to susceptibility to toxic social conditions. And MSM ethnicity impacts their perception, internalization, and stress response, demonstrating the effect of demographic, socioeconomic, and circumstantial factors on identity forming. The major ethnic disparities among Black men are attributed to particular social and cultural conditioning. Men are more likely to internalize internal attitudes on homosexuality in African American communities, and the fear of shame prohibits them from revealing their identities. Racial minority stress are described by the development of gay identities and social network has a profound impact on sexual behavior and is a major contributor to MSM sexual risk-taking behaviors. According to a report, African American men are less likely to have a well-defined sexual orientation. The social background is said to have affected the discrepancies, the creation of social network that affects sexual activities among Black MSM and is influenced by race. Black MSM have a higher rate of HIV infection than other MSM. As a result, the population risk of HIV infection rises because there are more HIV positive Black MSM in the community. However, it is arguable that sex mixing aids HIV transmission. The authors of the study found that Black MSM were more likely than other MSM to disclose having anal sex with anyone of a different age group, increasing the risk of HIV infection. African Americans make up the largest population of the homeless MSM. Since most African Americans do not accept the homosexuality, teenagers who reveal their sexual orientation risk being kicked outside the community. There's a clear correlation between racism and poor health outcomes, according to the academic studies. In the United States, racial segregation is a well-documented problem that persists to this day. The crime is mainly aimed at African American men in their daily lives, and it is related to sexual risk-taking and enhanced transmission of HIV among Black MSM. For example, the impact of racial inequality on HIV/AIDS health disparities can be seen in residential segregation. HIV rates are overwhelmingly high in areas inhabited by minorities, especially African Americans. Racial prejudice, which is a product of systemic disparities, increases the danger of psychiatric problems and decreases access to health services, of all which increase the probability of dangerous actions. As a consequence, it is indeed crucial to analyze and comprehend the effects of racial inequality on Black MSM based on evidence-based facts in order to design successful approaches. For people of color, racism is a significant cause of psychological trauma. Minor cases of racial inequality lead to mental diseases, costs as they occur regularly and continue over time. Owing to social conditions associated with racial inequality, Black MSM is less likely than white MSM to have adequate healthcare access. Besides, HIV positive African American MSM may have a higher infection rate and spread HIV to their sexual partner as a result of suboptimal health care. Members' opportunity to access well-paying careers and schooling is harmed by racial inequality. Homelessness and poverty are more likely among the participants as a result of the causes. When Black MSM are unable to find employment in their neighborhoods due to homophobia, the situation becomes much worse. Deprivation induces most MSM to engage in drug and alcohol addiction, as well as other risky behaviors. People seeking mutual and reinforcement from other homosexuals by frequenting gay bars, where there's a high chance of having sexual contact with outsiders. Several measures that recognize the impact of racial inequality and racial factors on sexual risk-taking activities by Black MSM must be taken in order to minimize the incidence of HIV infection. Present approaches according to experts approach the dilemma on an individual basis without taking into consideration the external social impact on the people. Black gays face dual marginalized tension. Stress from being a minority race in a racist American society, as well as stress from being an MSM in a community that rejects homosexuality. Both causes are linked to a delayed sense of self, which is linked to sexual risk-taking habits. When designing and implementing health strategies, policymakers should consider the external factor that influence high prevalence among the Black MSM. Furthermore, community health workers should teach African American families about teenage male sexual orientation development. They should also be informed about the impact on health consequences so that parents and guardians can provide MSM with social support. It would allow others to report their identity, reducing of contracting mental problems and engaging in substance and alcohol misuse. Keeping in view the clinical implications of the Black MSM, there's no evidence-based approach implemented to study the proper factors that contribute to the higher rate of HIV. Besides, these Black MSM do not disclose their identity due to shame and suppression that ultimately leads towards multiple partner sex to overcome their anxiety and stress. It means that identity is one of the factors that contribute to anxiety and stress in Black MSM. Furthermore, they become addicted to the overdoses of drugs and alcohol that can lead to other diseases such as a heart attack and lung cancer. Lastly, the chance of HIV infection is higher when there's no protected sex. Similarly, Black MSM most prefer unprotected sex. That is one of the reasons for the higher rate of HIV infection. Future research should look for whether racism has an effect on sexual orientation. The research has only looked at the impact of tradition or human beliefs on gays, sexual risk habits on their own. Combining the two factors, on the other hand, it is important for a thorough understanding on the cultural impact on action as it applies to personal and group values. While surveys conclude that racial disparities and sexism have an effect on sexual risk-taking attitudes, personal ideas and conviction also have an impact. For example, some MSMs prefer different sex partners, while others prefer a monogamous relationship. It has a different effect on the level of sexual risk-taking activity. Understanding the effect of bias on human sexual interests will assist policymakers in creating a more systematic approach on combating the risk of HIV among Black MSM. To sum up, it can be conducted that from the above study, it is clear that Black MSM have a higher rate of HIV than other MSM. Black MSM can be properly studied when both social and cultural contexts are combined. It means that one cannot know exact factors unless until they are evaluated in every context of life. Also, the behavioral study of Black MSM reflects that they need support both socially and morally. For instance, they always hide their identity in society because they are afraid that they will be thrown out of society. Hence, the positive role of family and policymakers can overcome the higher rates of HIV and Black MSM. Thank you. I hope you like my oral presentation. My name is Beverly Rodriguez. Have a good night.